Welcome, everyone! In this video, you will answer 20 multiple-choice questions about malaria. Each question comes with the correct answer and clear explanation to help you learn and revise. Try to answer before the timer ends. Let's get started. 1. What is malaria? A. Viral disease. B. Bacterial disease. C. Parasitic disease. D. Fungal disease. The answer is C. Parasitic disease. 2. Malaria is transmitted by which? Mosquito. A. Housefly. B. Aedes. C. Anopheles. D. Culex. The answer is C. Anopheles. 3. Which parasite stage infects? Red blood cells. A. Sporozoite. B. Merozoite. C. Gametocyte. D. Eukaryote. The answer is B. Merozoite. 4. Which species causes severe malaria? A. Plasmodium vivax. B. Plasmodium ovale. C. Plasmodium malaria. D. Plasmodium falciparum. The answer is C. Plasmodium falciparum. 5. The most common malaria symptom is A. Cough. B. Fever with chills. C. Skin rash. D. Diarrhea. The answer is B. Fever with chills. 6. The best routine test for malaria diagnosis. A. Widal test. B. Urine test. C. Blood smear. D. X-ray. The answer is C. Blood smear. 7. Why does malaria cause fever? A. Liver infection. B. RBC destruction. C. Mosquito bite. D. Dehydration. The answer is B. RBC destruction. 8. Which stain is used for malaria microscopy? A. Gram. B. Ziehl-Neelsen. C. Giemsa. D. Safranin. The answer is C. Giemsa. 9. Which form of Plasmodium is injected into humans? A. Merozoite. B. Sporozoite. C. Gametocyte. D. Trophozoite. The answer is B. Sporozoite. 10. Which species can cause relapse? A. Plasmodium falciparum. B. Plasmodium malaria. C. Plasmodium vivax. D. Plasmodium knowlesi. The answer is C. Plasmodium vivax. 11. Which blood smear is best for detecting parasites? A. Thin smear. B. Thick smear. C. Buffy coat. D. Plasma smear. The answer is B. Thick smear. 12. Which complication is common in severe malaria? A. Hypertension. B. Cerebral malaria. C. Asthma. D. Arthritis. The answer is B. Cerebral malaria. 13. Which antimalarial is used for severe malaria? A. Chloroquine. B. Primaquine. C. Artesunate. D. Doxycycline. The answer is C. Artesunate. 14. Which lab finding is common in malaria? A. High platelets. B. Low platelets. C. High calcium. D. Low cholesterol. The answer is B. Low platelet. 15. Which malaria parasite infects only humans? A. Plasmodium knowlesi, B. Plasmodium falciparum, C. Plasmodium vivax, D. Plasmodium malaria. The answer is B. Plasmodium falciparum. 16. Which malaria species causes quarter fever? A. Plasmodium knowlesi, B. Plasmodium falciparum, C. Plasmodium vivax, D. Plasmodium malaria. The answer is D. Plasmodium malaria. 17. Which stage is seen in peripheral blood smear? A. Sporozoite, B. Hypnozoite, C. Erythrocytic stages, D. Eukaryote. The answer is C. Erythrocytic stages. 18. Which malaria species enlarges RBC? A. Plasmodium falciparum, B. Plasmodium malaria, C. Plasmodium vivax, D. Plasmodium knowlesi. The answer is C. Plasmodium vivax. 19. Which feature suggests Plasmodium falciparum infection? A. Scheffner's dots, B. Band forms, C. Multiple rings in one RBC, D. Enlarged RBC. The answer is C. Multiple rings in one RBC. 20. Which antimalarial prevents relapse? A. Chloroquine, B. Artesunate, C. Primaquine, D. Quinine. The answer is C. Primaquine.